Hello, doctors. This is Dr. Baliga. This podcast belongs to a group of 11 podcasts on asthma, derived from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Christopher H. Fanta, MD, who is the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and Mass General Hospitals and affiliated community hospitals in the Boston area. He is a member of the Pulmonary and Critical Care Division at the Brigham and Women's Hospital and a full professor of medicine at Harvard Medical School. He is the co-author of the Harvard Medical School Guide to Take Control of Asthma, published by Simon & Schuster in 2004, and the Asthma Educator's Handbook, published by McGraw-Hill in 2007. After listening to this series of podcasts, the listener should have a solid foundation on the topic of bronchial asthma. Multiple choice question. A patient with asthma, nasal polyps, and a reported history of aspirin allergy should avoid which of the following medications for postoperative pain control? A. Codeine, B. Meperidine, C. Ibuprofen, and D. Tramadol. And the answer is ibuprofen, which is C. In the context of asthma and nasal polyposis, a history of aspirin allergy is suggestive of aspirin-exacerbated respiratory disease. The reaction to aspirin may have been in asthma exacerbation, perhaps accompanied by nasal congestion and rhinorrhea, and sometimes by abdominal discomfort, occurring 30 to 120 minutes after ingestion of aspirin. In this case, the patient should be advised to avoid all cyclooxygenase 1 inhibitors, such as aspirin and NSAIDs, such as ibuprofen. A cyclooxygenase 2 inhibitor, such as celecoxib, is generally well tolerated in low doses. Other analgesics, such as codeine, meperidine, and tramadol, would not be expected to trigger an asthmatic reaction. This podcast was derived from an outstanding chapter on asthma authored by Dr. Chris Fanta, MD, who is a professor of medicine at Harvard Medical School, and he's the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and the Mass General Hospital and the affiliated community hospitals in the Boston area. He's the co-author of the Harvard Medical School Guide in Taking Control of Asthma and the Asthma Educator's Handbook. This chapter was derived from Baliga's textbook of internal medicine, available at www.mastermedfacts.com. After listening to the 11 podcasts on this topic, the listener should have a solid foundation in asthma.